Welcome to Monday Night News. Today we're going to be talking about sports and the way our joints are affected. Follow along to learn more about our bodies. First of all, do we really even know what joints are?
No, I just know where they are, like your elbow and knee.
Let me explain. Every bone in the body forms a joint with at least one other bone, but sometimes many, and our joints are classified in two different ways by function and structure. Functional classification focuses on the amount of movement the joint allows. There are three types: synarthrosis, amphiarthrosis, and diarthrosis.
Wait, what do those three terms even mean?
Synarthrosis means that the joints can't move at all. Amphiarthrosis means that they're slightly movable, and diarthrosis means that they're freely movable. Freely movable joints are usually at the limbs, like your arms and your legs, while the immovable and slightly movable joints are restricted mainly to the axial skeleton, which is everything but the arms and the legs.
So they can also be classified by their structure, right? How does that work?
Yes, so there are three different types of joints that are classified by structure. They're called fibrous, cartilaginous, and synovial joints. This is based on whether a fibrous cartilage or joint cavity separates the bony regions at the joint. Similar to functional classifications, fibrous joints are immovable, synovial joints are freely movable, and cartilaginous joints can be movable and immovable, but are mostly amphiarthrotic.
I remember what that means. It means slightly movable, right?
Yes. Now let's head to the doctor's office to take a closer look. Here we are with Tally Pendleton, a doctor at Chambly Hospital. Today, she's going to explain what happens when you damage a bone or a joint.
Yeah, so today I'm here with Paige, who just recently got injured at her tennis match. I'm trying to determine the best way to heal her bone break.
Oh no, can you explain what happened?
I was playing in my tennis tournament. When I dove with the ball, I fell on my lower leg and it hurts really, really bad. Yeah, not good. From the x-rays, we can see that she has a simple fracture of her tibia bone. The bone is broken in two, but did not split the skin. Determining which technique to help the bone repair will be important in getting Paige back to tennis. One of the first method options is the electrical stimulation, which increases speed and healing. Bone tissue is dumped in areas of negative charge and absorbed in areas of positive charge to stimulate bone reabsorbing osteoblasts, which encourage bone growth.
Fascinating. Is that the only way that Paige can be healed?
Actually, there are a few other methods to choose from. Ultrasounds can speed up repair by stimulating cartilage cells with the low power waves. However, for a non-uniting fracture like this one, grafting is probably the better choice. The free vascular fibular graft technique uses pieces of the fibula to replace missing bone. I think we will probably choose this self-extendable endoprosthesis, which uses a metal device with a telescopic sleeve that automatically elongates the bone when the knee bends.
Well, it looks like Paige is in really good hands. Thanks for all the information. Now we're going to head over to the physical therapy specialist to see what she has to say. Hi everyone, I'm here with Sally, the PT specialist. She's here today to help us learn more about joints and how they work.
First, there are three different types: fibrous, cartilaginous, and synovial. Fibrous joints means that bones are united by fibrous tissue, like structures in the skulls.
Sounds a little complicated. Do you have a picture that could maybe explain?
Yes, this picture right here is a part of the skull, and the blue part represents the sutures.
Oh, thank you.
Next are cartilaginous joints, where the bones are attached by cartilage. An example of this is a slightly movable or amphiarthrotic joint in the pelvis called the pubic symphysis. On this board, we have a separate picture of a vertebrae and another cartilaginous joint because the vertebrae are separated by cartilage discs.
Sounds good. I think there's still one more joint that you have to cover.
Yes, the last type of joint is the synovial joint, which is when the articulating bone ends are separated by a joint cavity containing synovial fluid. Just an example of an elbow just that has all these four qualities.
Wow, I feel like I learned a lot. Before I only knew the names. Now let's go to meet a patient who has experienced these types of joint pains before.
I'm here with Maya, who was injured during her tennis match.
Ow, my shoulder!
She's experiencing inflammation in her shoulder, so let's look into how this could affect her when she plays tennis.
So what part of my shoulder is even affected?
As we learned from earlier, synovial joints are movable joints, and they can be categorized based on their movement. There are 6 shapes of synovial joints. Plain joints are flat and only have short movement. They are non-axial, meaning that movement does not revolve around an axis. Hinge joints are the connection between a cylinder and a trough-shaped bone. Pivot joints are between round and ring ends of a bone. Next is the condyloid joint, in which an egg-shaped bone connects to an oval-ended bone. Saddle joints are similar but involve concave and convex areas.
What kind of joint is the shoulder?
Well, that is the last one, the ball and socket joint. This joint is the connection between a spherical end of a bone and a round socket of another bone's end.
So when I fell on my shoulders, does that mean I can't play tennis anymore?
Only for the time being, it may hurt to move your shoulder. But once you're recovered, you'll be back to normal.
Thank you so much.
Of course, now I'm going to call up the orthopedic doctor so that I can get a second opinion.
Hi, I'm the orthopedic specialist at Chambly Hospital. There are multiple ways that joints can be injured, the most common in athletes being a sprain, which is when the ligaments or tendons in a joint are damaged by excessive stretching or they are torn away from the bone.
Is that what I have?
Possibly. The other potential possibilities for your joint pain are many forms of arthritis.
What? I thought there was only one form of arthritis.
That is a very common thought. However, there are many kinds. Some of them are osteoarthritis, which is the most common form. But that's most likely not what we're dealing with because you're much younger than the mainly affected population, the elderly.
That's good to hear. What else could it possibly be?
Another possible form of arthritis that could really be our issue is rheumatoid arthritis.
So that's what I have, but only one of my joints is affected, not my whole body.
It is a possibility, but since only one of your joints is causing the issues, I'm thinking it may be gouty arthritis, which is a disease in which uric acid accumulates in the blood and can be deposited as needle-shaped crystals in the soft tissues of joints. It typically only affects a singular joint and will present as a sudden agonizing pain. It can also cause redness, swelling, and tenderness.
That sounds like something I would have.
I thought so too. We'll run a few tests to see what's happening and get back to you. So your test results are back. Here they are. You do have gouty arthritis. There's no permanent cure, but a few things you can do to help soothe the pain are to take anti-inflammatories like ibuprofen, routinely exercise, and ice the affected area.
Sounds good. Thanks, Doc.